Okay, we're on your side with health news this afternoon. Springtime is prime time for ticks and Lyme disease. If you spend time outdoors, especially in the foothills of the mountains, ticks can be a major problem. And our medical expert, Dr. Nave, joins us now with some tips for preventing Lyme disease. How you doing, Doctor?
Good afternoon. It's spring next week.
Yeah.
Time to be outdoors. It's also an active time for ticks, which spread Lyme disease caused by a bacteria from a bite of a tick. This can cause a mild flu-like illness, and untreated can cause chronic health problems.
I always think of ticks as a problem for my dog, but they like
humans also.
They like the blood, right?
That's right. So there are 6 things that folks out there can do to prevent tick bites. The first is to know if you're at risk. People who are at risk are those who are in and around the foothills of the Sierra Nevadas, where there are brushy areas, tall grass, fallen tree trunks or logs. This includes campers, hikers, gardeners, outdoor workers, golfers, and children.
So does that mean no risk in the city?
That's
a lesser risk.
A lesser risk over here. It's up there in the foothills,
okay,
where you see these ticks. The second is to wear insect repellents containing at least 20% DEET, and parents should apply this to children over 3 after checking with your pediatrician. The third is to wear permethrin-treated clothing, including pants, boots, and socks. This can be purchased at a sporting goods store. And number 3 is to bathe or shower within 2 hours of being outdoors. Number 5 is to check yourself and your children for ticks daily when you're outdoors. Ticks like to hide in the ears, behind the neck, the scalp, the belly button, the groin. So you want to check these areas. And finally, if you've been in an area where there are ticks known to spread Lyme disease, check for signs and symptoms. If you have a bullseye rash, if you have a fever, fatigue, muscle aches, then let your doctor know.
So fever is one of the first things you would notice?
You could notice a bullseye rash, which is a reddish rash with a whitish area, or you could have fever, fatigue, swollen lymph nodes, muscle aches.
Yeah. Do we see a lot of this in this area? We're near the mountains.
It is starting to be more common. It's more of an East Coast phenomenon, but we are seeing it here in the foothills, in the Sierra Nevadas and the western slopes.
All right. Well, good advice today from Dr. Dave. Thank you so much.
You're welcome.
All right, Dr. Dave joins us every Tuesday right here on The Noon Show. If you have a question or a topic you would like her to discuss, email it to us at newsdesk@cbs47.tv.